Hello everyone, this is Jan from orJANics 50 and Raw, and I am here in my studio, just in between clients. I wanted to make a video for you guys. Yesterday was my 1-year anniversary of major surgery that I had, January 28th, 2014. I had a minimally invasive laminectomy on L4, L5 in my back because I had a severely herniated, ruptured disc, and so it has been a year since my surgery. And when I was looking for information on my surgery, I was on YouTube looking for videos and seeing people's experience. So that's why I want to make this video. Just a little bit of history. I started abusing my back really when I was in my late teens. I worked in a grocery store and I worked in the produce department, and I was the only girl in the produce department. So I had to keep up with the guys, and I had to frequently, I carried 40-pound boxes of apples and 50-pound bags of potatoes, and I worked in that produce department for 3 years. So that's where my back abuse began. And I didn't have any back problems back then, but you know, back injuries happen slowly over time. So I worked in the grocery store when I was in nursing school. After I graduated from nursing school, I got a job working with, I'm a neonatal intensive care nurse. So I never really had to move big, heavy patients, thank goodness. But one day while I was in the nursery, I was moving a chair from one side of the room to the other, and I picked it up, and when I picked it up, I felt my back go. It's the only way I can describe it. Just a little click in my back. And I thought, oh, that felt weird, but I was okay. But the next morning, I was in a lot of pain, and I had to go to the doctor's office. He gave me some morphine, and I had to stay in bed for a few days before the inflammation went down. So I think it was probably at that time that it maybe bulged. You know, herniated discs start as bulging discs. And so through the years, about 2 or 3 times a year, I would throw out my back or irritate that disc, and I would be in bed for a few days, and then I would be back to just normal living. But as the years have progressed, I've noticed that it would take longer to recover and was happening more frequently. In my studio, I have big machines. I have, you know, 40 or 50-pound boxes of salt, and you know, it's dumb, but my personality is if I have to move it, I'll just move it. You know, I don't really wait for my husband. Well, I didn't. I do now. Don't really wait for my husband to help me or anything. I'll just move it. So, in the summer of 2014, we were moving around some machines, my daughter and I and Jade, and I didn't really feel any clicks or anything in my back. But after that, my back was irritated, and when I would stand up, it would take me a while to, like, oh, you know, you know, one of the signs of a herniated disc is when you go from sitting to standing, you have back pain that just eases up over a few minutes, and that was me. So I was kind of walking around stiff, and but by October, I don't know what I did in October to my back, but I was in bed waiting for the inflammation to go down so I just could go on with life, but it didn't subside, and I was in bed for a few weeks. It didn't get better. A few weeks turned into a few months. I was going to a chiropractor. They used the decompression table on me to try and pull those vertebrae apart and relieve some of the pressure on that disc. It didn't work. The chiropractor, you know, massage didn't work. Oils, I was using, you know, a lot of doTERRA essential oils, and I was having salt baths every night. I was, you know, changing my diet to include anti-inflammatory foods. I was doing everything that I could possibly do to heal myself naturally. By December, I was not working in my studio any longer. I couldn't cook in my house. I could walk holding onto the wall or holding onto my husband. My right leg was almost completely numb. There was parts of my calf where I had no feeling in it at all. And so it was time to go to the neurologist. I had an MRI done, and my herniation was 10 millimeters. And I will post a picture, and if you know how to read MRIs, it's a pretty impressive size of a herniated disc. So my spinal cord had so much pressure on it from that disc, and then since the disc was ruptured, it had all that fluid around the spinal cord where it shouldn't be, so it was causing a lot of inflammation. So I went and saw a neurosurgeon, and he told me, yes, you need to have a laminectomy, and he told me that I would have to wear a metal back brace for 6 months and go through 3 months of physical therapy, and I cried. I did not want to get that surgery done. So I started to look at other options, and I started to look at spinal laser surgery, which has become very popular in the United States right now. I wasn't really a candidate for it, and also my concern was that spinal laser surgery is done by orthopedic surgeons, not neurosurgeons. So I didn't know that I wanted an orthopedic surgeon that close to my spinal cord. Now I did talk to somebody who had it done, and she had great results from it. And they had a 3-month waiting list as well, and you know, I couldn't wait 3 months. They told me that if I didn't take care of it quickly, the nerve damage to my leg would get worse and would be permanent, and I could end up crippled like forever. So I really fought having the surgery. I didn't want it, and I wasn't going to have it, but I have to tell you, they put me on the strongest pain medication. I was on oxycodone. I was on super strong medications, and I don't take medications. So they did not affect it at all. They did not relieve the pain at all. I couldn't sleep in the nighttime. It was up moaning and groaning with excruciating pain. You know, if I did fall asleep in the nighttime, I'd wake up crying and just, hurting so bad. And my husband would hug me and be like, Jan, I wish I could help you. And I wish you could too, you know, and just, you know, so by the middle of January, went to see another neurosurgeon. His name is Dr. Padilla here in McAllen, Texas. And he does a procedure called a minimally invasive laminectomy. So rather than taking out the whole disc of the whole disc of the L4, L5, he would just take out basically the part that was protruding and then let the disc seal over and let it heal. And so I went to see him, and he explained everything to me. It was a much less invasive surgery than the first neurosurgeon told me. Also, my concern was, would having a laminectomy later on lead to having a spinal fusion? And wanting to avoid that, seemed like if I had a total laminectomy, I would end up with a spinal fusion. So he was going to try, and I decided that yes, I would go with a minimally invasive laminectomy. And he was going to try and fit me in his schedule, which he was very full. So I went to see Dr. Padilla, and unfortunately, he had a very long waiting list. Neurosurgeons are extremely busy physicians, and we have a shortage of them here in the Rio Grande Valley. And so one morning, it was Sunday, and like by this time I was praying, oh God, please let them squeeze me in so I can get my surgery done. I was just praying to have my surgery done because the pain was so excruciating. My life came to a stop. My daughter and my husband had to work in the studio without me. My kids had to cook and clean and take care of me, and my life had just, I mean, literally I was disabled. And so Sunday night, I was like, please God, let it be tomorrow. So Monday morning, I called the office, the Dr. Padilla's office, and I told him, is there any way, please, that he can please squeeze me into his schedule? I am just in so much pain. So they called me back in the afternoon, and they said, yes, we can do you on Wednesday. And so I was just rejoicing at that point. So I went from totally, absolutely, I was not going to get surgery to literally begging for the surgery to happen. So on January 28th, 2014, I believe it was a Wednesday, we went in. I hobbled into the hospital, and just even standing there, like leaning against the wall, I couldn't sit, and people were looking at me, and they told my husband, oh, she looks like she's in such horrible pain. And I just was awful. And so they did the minimally invasive laminectomy. They videoed it. I wish I had a copy of that. But the doctor said it went very well. It was one of the easiest laminectomies that he had ever done. It took them about an hour and a half, I think, to do it. When I came out of surgery, went in the recovery room, I had like a burning sensation where they did the surgery, which is totally normal. I've had C-sections, and it's the same pain, you know, that pain of the cut it feels like fire where they cut. So they gave me, you know, pain medication to get through that. But literally the pain in my leg was really what was so horrible, and it was immediately gone. The pain in my leg left. They got me out of bed walking very quickly, and I went home after 24 hours. And the only thing that I couldn't do is he told me, don't sit in a chair. He said, I want you to either lay flat or be standing up straight. He said, no sitting for 2 weeks. That was a little difficult, but I mean, it was no big deal. So if I was at the computer, I put a big box by the computer and put the keyboard up, and, you know, did my computer stuff standing up or laying down. He told me to start walking as soon as I could. And so I did. I just at first started walking in the house a little bit, and then I'd get out in the driveway, do the circle, and then I'd go to the end of the driveway the next day, maybe do 2 times in the driveway. So little by little, I started walking every day. I needed no physical therapy afterwards, but I do wish that he had have scheduled me for some physical therapy to strengthen my back muscles. That's something that I really would recommend asking for if you ever do get this procedure done. By the time my 6-week follow-up appointment came, I was already walking 3 miles. So yeah, he was really impressed that I could walk 3 miles after 6 weeks. I felt strong. I was excited. I wanted to move. And so, you know, we just got out every day and got walking, and just took it easy, took it very slow. And so we did it. So it's a year later. I feel fabulous. I've had 3 instances since my surgery where I have been back in bed with back pain. The first time was 2 months after I had my surgery. We drove to Dallas, and I made sure to kind of stay flat, mostly flat, while we were driving. But when we got in Dallas, we slept on air mattresses. Oh, and the air mattress deflated. So that did it. I was out for a couple weeks, back in bed. The second time, we were at the beach, and we were driving on the beach, and I guess, you know, the instability of my spine, the rocking back and forth like this in the truck while we were driving in the beach in the potholes, I was in bed again the next day for another couple weeks to heal that inflammation. And then the last time was before Christmas. We drove to Dallas, and I was sitting for 10 hours, didn't get out of the car enough, didn't do enough stretching, and by the time we got to Dallas, my back was irritated and inflamed. I had some inflammation. So I'm working at strengthening the muscles in my back, doing back exercises and stretching. Seems like when I'm hurting, I'm more consistently doing them, and when I feel good, I'm not as consistent doing it, which is, I guess, human nature, you know. But that was my experience with my minimally invasive laminectomy. It was a good experience for me, and I'm very, very glad that I had it done. I don't believe that my back issues are over. I have to take very good care of my back. I have another herniated disc right above L4, L5, and it's controllable. So I no longer lift 40 pounds of salt. I'm much more careful taking care of my back and not abusing it. So I just wanted to share that with anybody who's looking for answers and guidance and experiences from other people about having a minimally invasive laminectomy, and I hope that helps you. God bless. Bye-bye.